Welcome to this week's edition of Freedom and Prosperity Radio, the weekly radio news magazine that we put together here at the Virginia Institute for Public Policy. I'm not sure, is it Sleep It Off Saturday, or actually no, it's Small Business Saturday if you go along the calendar, and where we encourage everyone to listen local, buy local, and most importantly, vote local. And if you are engaged in any sort of vote sharing with other states, please let the appropriate authorities know. Joining us this week, and I hope you all had a wonderful Thanksgiving, is Dean Clancy, Senior Policy Fellow at Americans for Prosperity and a Paragon Health Institute Public Advisor. Dean, I hope you had a wonderful Thanksgiving. Thank you for joining us this weekend. How are you doing today, sir?
Doing great, thanks.
I wanted to talk a little bit because there are quite a laundry list of lies associated with the Patient Protection and Affordable Care Act. I guess preeminent is the name, but one of them was that you're going to have the costs of health care lowered once the Patient Protection and Affordable Care Act was passed. We colloquially call it Obamacare, and you've got a piece on Americans for Prosperity talking about how the out-of-pocket costs are rising yet again, as well as the premiums, correct?
That's right. The cost of health insurance in this country has been rising dramatically since Obamacare became law in 2010, and that continues unabated. They promised at the time the bill was enacted that everyone's premiums would go down. You'd spend at least $2,500 a year less on average for your health insurance. But in fact, it's gone up significantly. The average premium now for an individual purchase health insurance policy is $22,000 a year, and you often have to pay, $8,000 to $10,000, $12,000 out of pocket before a penny of your insurance kicks in. So healthcare has gotten a lot more expensive since the government came in to make it less expensive.
And unfortunately, we were all saying this at the time before the vote happened, and now I guess soon to be outgoing Speaker Nancy Pelosi told us we had to vote for this in order to find out what was in it. And I guess this is why, Dean?
Well, exactly. They knew at the time that it wasn't going to save money. They knew it was going to add to the deficit, despite claims to the contrary. But they wanted to do it because they believed it was the right thing to do. They wanted to get everybody covered, even though, as a practical matter, most Americans were covered, and the uninsured problem really was not as serious as the press made it seem. And they want the government to be in control. Obamacare is just one step in a decades-long project which continues of a creeping government takeover of health care. Obamacare in 2010, price controls on Medicare drugs this year. Next year, they're talking about trying to impose price controls on hospitals, and it goes on. More and more government involvement. But what we've seen is that government involvement leads to higher costs and lower quality. So, for example, those Obamacare health plans, the ones that get subsidized by the government and are regulated by the government, which is actually most plans, they have what's called network shrinkage. Your access to doctors and hospitals is shrinking because of the mandates and subsidies in the law. It just doesn't pay the insurers to have lots of doctors and health plans available to you. They're trying to save money by shrinking your access to care. Meanwhile, ironically, the insurers are making money hand over fist. Their profits are up by double digits this year. And it's mostly because these huge taxpayer subsidies that are part of Obamacare are enriching them, but the quality and cost of care are not improving for patients.
Well, and as we pointed out at the time, as this debate was even, still theoretical, was that, the insurance companies were now going to get a guaranteed client base that they were missing out on before, and were able to restrict the size of the market. Now we see what it's doing to doctors as well. And a third part of this, is the control of the medical education world through our institutions of higher learning like UVA. And when we see the medical community under such control, it used to be the debate where we said, well, you don't have a right to somebody else's workforce. So when people would say, I have a right to health care, right after we finished explaining that Obamacare wasn't health care, it was insurance, and they weren't the same thing, we said, slavery was the idea that you had a right to somebody else working for you. But now it seems like the medical community is going along with this complicitly. Dean, what's to be made of that?
Well, you're absolutely right that the influence of the creeping government takeover of healthcare it's corrupting the whole system, and doctors and nurses and they're all becoming in effect servants of the government. And the job of being a doctor is getting less and less pleasant. There's a lot more burnout, people retiring early. You've probably experienced, being at the hospital at the doctor's office, and, he's looking at a computer, he's filling it out, he's not talking to you, and he's got to get you out of there in 15 minutes because the insurance system mandates that, basically.
Right.
To get paid, he's got to treat you like a hamster on a wheel and just run you through and get you out the door. So healthcare has been, it's gone down because of the government involvement. At Americans for Prosperity, we're trying to reverse that. We believe in what we call a personal option in healthcare. You may have heard the term public option or Medicare for all. That's where the progressives and the Democrats have wanted to take healthcare, put the government in charge. We say, let's do the opposite. Let's clear the barriers out from between patient and doctor so you have direct access to care. And you're right, having an insurance card, that's not the same thing as having access to care. Just because you have an insurance card doesn't mean you're actually getting an appointment with a doctor in a timely way, or the doctor you want to use or who is convenient to you. And so by removing barriers and also by empowering patients as consumers, we can begin to reverse this government takeover. We call that a personal option approach, and we're lobbying for that, advocating for it in all the states and in Congress.
Is it fair to point out, and we spent last week's program talking about school choice and education choice, this is really a healthcare choice, and you mentioned the numbers, the amount of your take-home pay that is disappearing from your home and from your pocket in these insurance premiums, that a robust health savings account system with the relatively modest costs of major medical insurance is really the way to go. And we've talked about this on frequent occasions, the direct primary care associations. Coupled with that, you've got a much better health care system for what seems to be pennies on the dollar, Dean.
That's absolutely right. If every American could save and pay for health care tax-free, big corporations get a big tax break for providing health benefits to their employees, but you and I as individuals, we don't get the tax break for our out-of-pocket health care purchases, or if we buy insurance individually outside the workplace. Let's level that playing field with tax-free health savings accounts. Right now, only 1 in 10 Americans have access to this powerful financial tool, which basically lets you stretch your healthcare dollar as long as you use it for qualified medical expenses. Every expense is like you get a discount because it's untaxed money that you're spending, and you can accumulate it, save it as a big healthcare nest egg for future years. And you mentioned direct primary care. That's an insurance-free model where you and the doctors have a monthly subscription arrangement. There's no extra fees, co-pays, co-insurance, hidden charges. It's just health care. You pay for it, you get access, and patients and doctors love it. And you also can get huge discounts on generic drugs through a direct primary care practice because they buy direct from the pharmaceutical manufacturers, cut out all the middlemen who are driving up drug costs. So that vision would be so much better for everybody. Prices would be lower, quality would be higher, we would have functioning markets in healthcare, and that's really what we're trying to achieve with the personal option.
Dean Clancy is visiting with us this weekend in between Thanksgiving and the beginning of the Christmas season here at Freedom and Prosperity Radio. And we're talking about something that is, approaching its bar mitzvah date, Dean. And, the Obamacare Patient Protection Affordable Care Act has passed in 2010. We went through that spate where the President of the United States says, bring me a repeal and replacement bill. And Congress, though they had passed dozens and dozens of show ponies or bills that never were going to get signed by the president, repealing Obamacare, couldn't do it once they had a president that was ready to sign it. So all of what we're talking about, what is the chance that it's ever going to happen again, that we're going to be able to repeal this Leviathan that empowers the IRS to control our health care?
Well, I would say that Obamacare repeal, like a full repeal of that whole act, is not on the near horizon for the reasons you said. The Republicans promised to do it for, I think, 7 straight years, and then they actually had the chance, and they failed by 1 vote in the Senate, and they haven't really tried to do it since. Mm-hmm. But that said, Americans have always thought you need to fix Obamacare. They've always been uncomfortable with it, and you can do a lot to fix it. And by the way, a lot of it has been repealed already. The individual mandate to purchase insurance, President Trump signed that bill that basically zeroed out the penalty on that. So now we're free again to be uninsured if that's our preference, which is, I think, the right policy for America. And there a bunch of the taxes in Obamacare have been repealed. But what's still there and needs to go are these federal mandates that micromanage what they enforce all these bells and whistles on you to, so it drives up the cost of the insurance. There's also mandates that incentivize insurers to jack up their premiums as much as possible, knowing that basically taxpayers are going to pick up the tab for most of it, and we're shoveling hundreds of billions a year at the insurers, wasting this money. We need to repeal huge sections of Obamacare, and when is that going to happen? Well, when we get a majority in both houses of Congress and a president willing to sign it. I think as health insurance costs continue going through the roof, I mean, they're going up 25% on average this year in the individual purchase market, and 10% on average in workplace health plans. It's not sustainable. People are going to demand more affordable health coverage options, and that, I think, will help to create that majority that we need. Whether it will happen in the next 2 years, I don't know. House Republicans said they were going to try to lower health care costs. They now have the gavels in the House, apparently, after this election. We'll see how far they push on it. Mm-hmm. A lot of what they do will probably be blocked by the Senate, which will be controlled by Democrats, or would be vetoed by President Biden. But they got to try.
Oh, absolutely. And this is something that is going to be a long game, and we mentioned direct primary care associations and health savings accounts. To a degree, they all still exist. And I mentioned the IRS, Dean. Every tax year, it says, did you purchase health insurance? So penalty or not, the IRS is still tracking whether or not you've gone through the Obamacare portal to buy health insurance that way. And I know that the penalty isn't there, but there are other penalties depending on what you put on your IRS form. So if you don't have insurance and you click yes, I did, that now you've lied on your federal tax forms, sure. And that's a felony unto itself.
Yeah, no, you're right about that. The actual mandate has not been repealed, just the penalty tax. It needs to be repealed as well, and ideally all of Obamacare would be repealed. One thing you could leave in place, it's one of the most popular provisions of Obamacare, that's the ban on pre-existing conditions exclusions. In other words, you basically don't exclude people because they have a pre-existing medical condition. Now, that's not the ideal policy in terms of insurance. I mean, it's like saying you can buy fire insurance when your house is already on fire. But there is a way to make it more reasonable. The prices, we can still get the prices way down and have health insurance be a lot more like real insurance by removing a lot of those mandates on insurance that I talked about earlier.
Is this something, and it's interesting how it played out, and it seemed like in the popular press that the insurance companies were being forced into this. But as we watched insurance companies pulling out of insurance markets, often leaving only one insurer in big parts of Virginia, especially, there was usually only one choice who got to decide what the costs were going to be anyway. It actually seemed like this was more about protecting and promoting and pumping up the insurance industry than it was even about the healthcare industry, as big as those, big mega hospitals have become.
You're absolutely right. There's been a terrible concentration of power in American healthcare, and it's a direct result of misguided government policies. We now, as you point out, in many states, there's only one insurer in the individual purchase market, or two, not much competition. And you have these large hospital corporations which have gotten into the insurance game. And then you have insurers which are getting into the, basically buying hospitals, and the hospitals buy up doctors' practices. It's all turning into monopolies and cartels, and it doesn't have to be that way, but we've got to empower consumers. My line is, in America, the patient is not the customer. The patient is the product.
Yeah.
The real customers are these big entities, and we got to break them up through competition.
It seems like I said, we've been saying this for almost 15 years. If you look at the biggest, most notable antitrust suit in the United States, Standard Oil still didn't require you to pay them for a membership in their club so you could buy their fuel from them. If they did that, then they'd be just like the insurance industry, because they do control the doctors and the patients. And that's often how they manage to control these doctors and tell them you can't spend any time with the patient, often leaving patient wondering, how they're going to get. And I think there's been an increase in mistaken surgeries and treatments that have run awry because doctors don't have the time, because they've been scheduled by the hospitals, which again are controlled through this collective.
Absolutely. I love your Standard Oil analogy. Big insurance today is worse than big oil was in the day. I mean, Standard Oil was always lowering its prices. That's why it was like a monopolist, because it did its job so well. But insurers, they're always jacking up their prices today. I'm not for breaking them up through kind of, big government top-down approach. I think if we empower consumers and patients, if they're controlling the dollars, if they can opt out of excessive insurance coverage, we all need a safety net financially, and we need true insurance, but these bulked-up Obamacare plans are too much. If we can empower consumers, we can break up those monopolies and have a much, much better health care system.
And remind people, what the average American is paying out of pocket. And if you think about it, you were mentioning the health savings accounts. I think this saves our entitlement programs like Social Security and Medicare, because if I can start saving at 25 like a 401k, by the time I'm 50, I have so much money saved up in my health savings account that as long as it's for health care, I could give my grandkids a trip to the doctor if they need it, or I certainly don't have to worry about a hip replacement.
No, that's right. An HSA you can use not just for yourself, but for your spouse and dependents for their health care. And you're right. What you don't spend, you keep, and it builds up. And in fact, an HSA is the most generous tax advantaged account in America. It's even more generous than an IRA or a 401k, because the money is never taxed. The money going in, the money coming out, the money building up inside the account, all tax-free. No other account like that. And you're right, most Americans are relatively healthy most of the time. It's sort of the 80-20 rule. 80% of us are healthy most of the time. So 50% of Americans don't spend more than $1,000 out of pocket on health care in a given year. Now, that's not counting premiums. We've talked about how expensive those are. But in terms of their out-of-pocket expenses, most of us don't spend much. That means that if you max out your HSA every year, and you're right, if you start in your 20s, by the time you get to your 40s or 50s, you've got a real nest egg there. And by the way, you can invest it if you want, or you can keep it safely in more like a savings account. It's up to you. And you can use it for yourself, your loved ones, and when you die, whatever you haven't spent, you can leave to your loved ones. It's really a great tool. Only 1 in 10 Americans has access, thanks to onerous federal barriers that we need to remove. 100% of Americans should have access to this tool.
Yes. Amen to that. It is medical choice. And remind folks over, the holidays as you go shopping with them, maybe you have family coming by for a weekend Thanksgiving follow-up. Remind them that health insurance isn't the same as health care. Dean Clancy, AmericansForProsperity.org. Just let people know how they can find out more and maybe join in so they can help this lobbying effort going into the new Congress and even here in the Commonwealth of Virginia.
To learn more about AFP's healthcare strategy, which we call a personal option, please visit personaloption.com. That's personaloption.com. Love
it. Dean, you have a wonderful weekend, and we'll talk to you again very soon.
Thank you. It was my pleasure.
Coming up next on Freedom and Prosperity Radio, Vincent Vernuccio, a visiting fellow with the Thomas Jefferson Institute. And you may not have seen this, but Virginia has dropped from an A+ to a C grade in worker freedom. Why is that? He'll tell us next on Freedom and Prosperity Radio.